want to thank everybody for coming. We got a very special guest and a great friend of mine that's going to be here. I can just tell you that mental health has become such a big issue across the country. I think there's 23 million people that are affected by mental health, mental illness issues, and they say 1 in 4, 80 million, have a bout with it at some point in time. But you take a look at what's happening with the homeless and what's happening with even our veterans that find themselves homeless and others. We haven't done much in this area, really in the last 60 years since JFK. We're spending your money, about I think it's $125 billion a year. The congressman, who's a working psychologist for the last 30 years, has worked closely on this whole area, but for the last year, he has spent a lot of time and energy and effort and had a lot of hearings with a lot of families and experts, but he's also a practicing psychologist, and I might say the only one in Congress. So I want to do everything I can to help him be successful, but to do that, I want to get the input from the community, yourselves today. We just met with a lot of the stakeholders for an hour. We've been meeting with the papers locally. So we've got a good bill. I think it's a great bill, but there's always something maybe we can tweak or adjust. But with that, let's give a big round of applause from Pittsburgh, Pennsylvania, Congressman Tim Murphy.
Thank you. Thank you. Good afternoon. Great to be here in the winter home of the Pittsburgh Pirates. And probably a lot of constituents come down here too. First, Congressman Buchanan, thank you so much for your interest in this, your passion about this issue. He's been a real leader in Congress on this and a leader with getting the Florida delegation on board with this too. And thank you all for your work. I'm going to spend just a couple minutes talking about what this bill is about and what it did. But I want to start off by saying I just want to know, is anybody here a provider that works with people who are seriously mentally ill? Okay. That's important. What I'm going to say may not make sense if you don't work with a seriously mentally ill, as a family member or somebody else. This is not about the worried well. This is not about people going through, as Vern said, you've got, if you have 25% of Americans sometime during any given year will face some level of mental illness, from very mild transient to very severe mental illness. That we've got about 9 or 10 million people in America who have severe mental illness like schizophrenia or bipolar, and of that about 4 million who are not treated. What we know is a number of factors here. If someone is mentally ill, that they're 3 to 10 times more likely to be victims of crimes, burglaries, assault, sexual assault. Their children are 3 to 4 times more likely to be victims of sexual assault. People who are seriously mentally ill are perhaps 15 times less likely to be involved in a violent crime as a perpetrator if they're in treatment. We know treatment makes a difference. We know also, however, of an investigation that I led as chairman of the Oversight and Investigation Subcommittee in the Committee on Energy and Commerce after the Sandy Hook shootings, that the federal government has put a lot of barriers up to treatment. For example, there's a rule in Medicaid that says you can't bill for 2 doctors in the same day. There's a rule that says Medicaid can't have more than 16 beds in a psychiatric hospital. We've gone from nearly 600,000 psychiatric hospital beds in the 1950s, when the population of this country was 150 million, to now less than 40,000 psychiatric hospital beds when the population of this country is double that, 316 million. We have found that generally what happens for the severely mentally ill, you're 10 times more likely to be in a jail cell than in a hospital bed. That we have people who cannot access outpatient treatment, the inpatient treatment, all these are problems for them. And our bill addresses a lot of this, as well as putting accountability on how the federal government spends dollars, which is right now not a lot of accountability. So this bill, the Helping Families with Mental Health Crisis Act, is the bipartisan bill in Congress. Been getting a lot of feedback around the country. We're here today to get that too, to see what you like, what we can improve, what we can perfect. But one thing's clear, we're not backing down. When you have this many Americans with this much illness, mental illness is the highest rate of non-fatal illnesses in the world. And you had more people die last year of suicide than homicide. 40,000 suicides in this country last year, and a lot of those from mentally ill people. 1 million attempts. You have 30 to 50% of people in our jails are mentally ill. You have perhaps as high as 60, 70% of those who are homeless, but at least 30 to 40% are mentally ill. You have a higher rate of unemployment. You have substance abuse, all these problems. But America has continued to pretend it's not there and brush it aside, and Congress is not going to do that anymore. And it's going to take the leaderships of people like Vern Buchanan. Elsie Hastings is also on board, has a strong voice. This is bipartisan, because we recognize mental illness doesn't know a color, doesn't know a party, doesn't know an age. It's there, and we have to make sure we work on those. So we'll open it up now and take what kind of comments you want to move forward.
Yeah, just we want to thank him for being here. I mentioned one of the statistics I looked at is we haven't dealt in this area in 60 years since JFK. And at one point, I think we had 600,000 beds.
600,000 hospitals.
And today we got 40,000 beds. So just from that statistic alone, and the other thing about his bill that I really like is there's no sense of accountability. We're spending $125 billion, but what are we getting? What's working, what's not working? This bill will go a long way addressing this with the Assistant Secretary. So some of the things I was concerned about, it's in the bill. But today, what we want to do in terms of Manatee and Sarasota counties, we want to get your input, your thoughts. I'd like to make sure you can help me, help him by getting any comments that you have or any questions that you have of the Congressman. What I'd like to do is lead it off with maybe this initially, if someone would be open to. Anybody that's dealt with mental illness in terms of a family member or a close friend, if someone would share that story,
yeah, what's it
maybe
like?
What's it like? What do you deal with on a daily basis? I think that would be a good way to start out. Yes, ma'am.
Nate, we'll bring your microphone down here real quick and just, if you make a brief story about that, maybe tell us in a minute or so. What's it like?
Yes, my name is Barbara, and I'm glad to see so many of you here because awareness is the key word here. I have been involved with my daughter since she's 30. No, let's see, she was 20. She is now going to be 54. She's bipolar, schizophrenic, manic depressive. She's been Baker acted twice, but after 3 days, they just release her and go. She is getting worse because all the meds are finally, the side effects are very bad. So I'm glad to be here, and I know you all have a story to tell. God bless.
Thank you.
Anybody else, a family member who can tell us what it's like? I mean, so what happens? What happens with your family member?
Sally.
Go ahead, right up here.
We've got a mic on each side, Danny and Sally, so if you'll raise your hand, they'll get right to you.
My family member is my son, who's 39, and he's been in and out of the hospital since 19. I just took him there Sunday night to Bayside. Bipolar, whatever, and dual diagnosis at this time. He's been homeless for weeks. I tried to get him in the services we have in Sarasota County for independent living, and he couldn't manage the rules, so he's out of there. And I know he's been exploited. He can't hold on to anything, any money, and he's an incredibly talented artist, tile setter, mosaic designer, and a beautiful person. But he asked me for help, and I took him to the hospital again. And this time, they're looking into maybe a month-long treatment program, from Bayside. But it's hell, and I don't ever know if he's alive or dead. And I can't have him in my home. I tried that for 1 solid year, and I was nuts at the end of the year. He can't live in a home. He cannot live in a home. He needs care, and so that's all. I just
Did you say you don't know where he is?
I know where he is today. He's in the hospital.
Okay.
But when he's out living on the street, I never know where he is, and he calls me regularly. I never know. He never knows where he's going to be, and he's so vulnerable. People take his money. People just take. He had a bicycle twice. They take the bike from him. They take his phone. They take. He's incapable of managing himself, and yet he's got the right to be out there. There's no place for him to be.
When you say the right, tell me about that. What do you mean he has the right to be out there?
Well, he can say, he can. He's got the legal rights to. Not that I want to take his rights away from him.
No, but that's a very important part. And let me ask this too: when he is getting care, does the hospital staff and the doctors talk to you and get the history and background and information from you, or do they say, no, we can't talk to you?
He's always allowed them to talk to me.
Now, does anybody experience it, any family members, where they won't talk to you? Could you hand the microphone to the woman right next to you? So you experience that people won't talk to you?
I have over and over. When he was younger, my son's 30 now, when he was younger, he had allowed me to participate in his care. But later on, after many really hard choices that I had made, like putting him into drug court and everything else, when he was younger, he recognized that I saved his life. When he was older, he blamed me for everything. Mm-hmm. So he no longer lets me participate in the hospital. They won't tell me anything, but I've learned that I can tell them, I can give them information.
You can get information, but will they even give you information on who his treating doctor is, what his medication is, when his next appointment is?
They won't even tell me he's there.
Okay. Who else experiences that barrier? Yes, sir.
I've had a similar problem. I've had a son who's now 51, started suicidal ideations at the age of 7, has gone through a series of interactions with the hospitals in Connecticut. He's been arrested. He's been in jail. He is disabled. He is bipolar, ADHD, personality disorder, et cetera, on top of which he's physically disabled. He has applied for Social Security numerous times, been denied, reapplied, denied, has an advocate fighting it. The doctor who examined him was a gynecologist, and we have yet to figure out why the federal government is paying a gynecologist to do a disability examination.
Wow. That's something Ways and Means can do.
Yeah.
That's a serious problem. So, but I want to also find out, is there anybody else who ran into a barrier where, as a family member, you tried to give information to the doctors and they said they don't want to talk to you? Can you help this woman?
Yes, sir.
What was the barrier you ran into with that?
Hi, yes, I have an adult child with bipolar 1 disorder with psychotic features, and at the time I was trying to get him hospitalized. I actually live in Clearwater. I drove from Clearwater. And he was coming voluntarily. We went through the ER. We got him into a room. And when I was suggesting certain issues of anosognosia, to the nurse that was in the room, and I was mentioning, why did we come here? Why did we come here? He was changing the subject, and when I kept bringing it up, he said, I want her out. He told the nurse, I want my mother out. They left me in a hallway for hours. I had no idea what they were doing with him. They wouldn't communicate with me. Finally, I called maybe 5 or 6 hours later to see, are you admitting him? Can I see him? And I was told by the ER doctor that there was nothing wrong with my child. My child, we had to Baker Act him in 2010. He was in treatment for a year, 6 months in Texas, then here in Florida. The ER doctor told me that there's nothing wrong with my son.
Was he a psychiatrist?
Yes.
And the ER psychiatrist said there's nothing wrong with your son, but you weren't allowed to give information, right?
They wouldn't give me any information.
So are you all aware what anosognosia is that she mentioned? For those who are not, let me describe that. Anosognosia is a medical neurological term which means you are not aware of your own illness. This is not uncommon in situations of stroke, Alzheimer's, neurological problems. Some types of, about 40% of people with schizophrenia or bipolar are not aware. And the way I heard one psychiatrist describe this, they don't think the FBI is after them, they know it. They don't think that the CIA has planted electrodes in their brain and is probing their mind and sending them signals from outer space, they know it. They don't think that they're the Messiah, they don't think that they're the angel Gabriel come down on a mission, they know it. And so when you talk to them about, this is not right, these voices you're hearing are hallucinations, these are delusions, this is not appropriate, it's not real, they will fight you and think because you are fighting them, that therefore you must be part of this. Now this is not everybody, but it is like about 40% of those with severe mental illness, and those are folks who oftentimes refuse treatment, refuse follow-up. And the question is, when the person is at that level of crisis, what should we do? And if hospitals are saying, we're not going to listen to you, we're not going to take your information, we're not going to include the family. So a lot of states have something called assisted outpatient treatment, where family members and physicians can actually petition to say this person needs to be compelled to stay in treatment. Dade County, Florida has an exemplary program on that. I don't know the actual ones out here in this county area, but it can be very helpful. But the point is, HIPAA laws are supposed to be there to help you, not stand in the way. Doctors are allowed to listen to information. You said they are. But a lot of times they think, oh, I'm not allowed to talk to family members. They absolutely are. But the barrier we heard from a lot of families is, look, I'm the one that's going to be responsible for my son or daughter or my brother or sister or my mom and dad. Can you at least tell me who the treating doctor is, when is their next appointment, and what's their medication? According to the current standards of HIPAA laws, you're not allowed to know that. And I think that, I wouldn't make it blanket, but using the highest level of professional ethics of psychiatrists, psychologists, social workers, be able to make a decision in this case is, okay, he's lived with you, he's worked with you, all these things, or care for him. I'm going to give you enough information. I'm not going to tell you every detail of his life. I'm not going to go over all the details here. We'll keep that confidential. But to the extent that you are there to help partner with him or her to help get them better, we're going to work with you on this information. But this is one of those places the federal government says, we don't think you should be allowed. Now imagine if we did that with a heart attack or a stroke or diabetes. If you brought your son in and he just had a heart attack and they said, I'm sorry, we can't talk to you. Well, I need to tell you he's having a heart attack. I'm sorry, no information, please, go in the next room. If someone came in with an auto accident, unconscious, they would listen to everything you said. They would tell you everything. How is it that we have this other standard for someone who's mentally ill and say, you know what, you don't count. We're going to treat this disease like it's not a disease. It is a brain disease. We have to work to help these people in a way that helps them get better. So that's what we want to do.
So partly the bill addresses that.
The bill does address that. On the HIPAA laws and we're working on really crafting this and refining it better, so we're looking for input to say, where do we draw this line, but always saying that the professionals have to keep their ethics and really get that information. Yes.
I have a question regarding the Guardian Ad Litem program, who is responsible for the welfare of a child, the best interest of a child. We cannot get information on mental illness of parents. When parents' rights are going to be terminated, and we need to have that information. I mean, we're not the parents of the child, but we're talking about best interest of a child here, and we can't get it, even though it's court-ordered sometimes.
Some of it's probably state issues of how those things are defined, of where those orders go. And that would be making sure that, and I know Vern Buchanan and others will be working, also talking. This has to be a conversation that takes place between families, your county commissioners, your municipal folks, the state legislature. We've got to change this broken system, but that's one of the issues too, in terms of if someone is a guardian and someone starts to change it. But at least in this state, I think it's 18 is the age of majority. In Pennsylvania, it's 14. Who came up with that? A 14-year-old, you wouldn't let them do anything else. 14-year-old can't even decide not to go to school anymore, but we're going to let them decide their medical care.
Let me just ask you, ma'am, you're talking about you had a challenge getting information as it relates from what city, county, the state, or where?
Coastal.
Okay. All righty. Thanks.
Hi, yes. I brought my brother down from Rhode Island. He was in the VA up there, and he had been there for about 6 months. He was older and was diagnosed with Lyme's disease, positive, and had had it for some time without being diagnosed. So he was actually had ataxia and aphasia. He couldn't dress himself. He couldn't do anything right. And I got down here, and there wasn't any place except one home that they put him in, and then the doctor there was drugging him up so much that he was falling down. He was just a nursing home doctor, not just, but a nursing home doctor. And I finally got to the point where they wouldn't listen to me there. I called them budsman. And I talked with a very nice nurse, and she put me in touch with a neurologist. The neurologist tweaked his medications to the point where he was just a wonderful little gentleman. Nice enough to be able to go into another home. He got there, and the doctor there tweaked again. And at this time, he ends up, being very abusive to other patients, sticking his fingers in their eyes. And he went from home to home to home in Sarasota, and then up to Bradenton. He'd been in Bayside, and they were wonderful for about a month, and then no one in Sarasota would take him. He was not fit for a memory unit. He was not fit for a nursing home. There's no place to put him because of his behavior. Yeah. And he wasn't always like that. And it was a nice nurse at Bayside, and he said, "You're going to have a lot of trouble placing him," very quietly, because he had been in construction. He dismantled 2 chairs, that are all 3 that are all hooked together. I didn't know this until the nurse took me down, and he said, "You're not going to find a place for him because he does this." He wasn't being mean or meaning to be, but that was my problem. I found nothing here in Sarasota for my brother, and I had to spend all my time going to the assisted living that I finally got him in, just to make sure that he was being treated properly.
Well, let me say how our bill is going to help address some of those things. So first of all, we mentioned before that the things with regard to the HIPAA laws, there will be some change we want to make on that. Also, providing more psychiatric hospital beds. There is a severe shortage across the nation. And there has to be more. And part of this is say Medicaid is no longer going to have this 16-bed rule. We will want to keep people out of those for long terms and say they have to have an average length of stay of less than 30 days. But it should not be a situation if you have good private insurance, you can get care. And if you don't, you're on your own. So we'll deal with some of those things too. Also, more money for research on brain research. We also have a program on there that is called Response After Initial Schizophrenic Episode. The RAISE program, very positive results, gets in early in helping people's lives. We realize if they are on proper medication and proper psychotherapy and other intervention, they do much better. No, I might say even after the introduction of this bill, 2 agencies, SAMHSA, Substance Abuse and Mental Health Service Administration, and the National Institute of Mental Health, they departed their ways about 20 years ago and haven't been playing together in the same sandbox very well. They actually came to an agreement as pressure from this bill, and now they're going to start doing the RAISE program, a substantial amount of money around the nation to do that. So these are things that we're trying to address in this bill and working towards. Other comments?
Hey, let me just say one thing so I just don't forget later. Take a look at the bill. You can go online, the congressman online, or we'll have the bill online ourselves. Let me know your thoughts and your input so I can make sure I get that feedback to him. We'll be back in Congress in September, but I'd like to gather up as much as I can from our communities and make sure that he considers that in terms of going forward.
Other thoughts? Yes.
One thing you may want to consider is I know that when my stepson is doing well, he gives permission for his father to know what's going on. And then the minute he is off or gets angry or whatever, he takes it away. Since it's a mental disease, and they take it away, we're gone. That when he needs us most, it's gone. And could you put in the bill that once given, it can remain, I mean, with mental, because obviously that's a pitfall with the mental disease.
Sure. Well, there's a couple of things with this we're trying to address in the bill. First of all, there is something called an advance directive. Are you familiar with that? So an advance directive, you have an agreement where that person actually signs that statement, and it talks about all things they can do. You're right, but they can revoke it. So that other part, the reason we have to have HIPAA clarified, and this is another thing that HHS did since we introduced the bill, they provided some clarifications. We have to make sure that hospital lawyers and administrators understand this. They can listen to you. They can listen to you providing that history and background. Right now, however, if you call a hospital and say, is my son John Doe there, that says, we can't answer that question, they hang up. But what they can do is provide, if you show up there and you says, look, I'm his mother, I'm his stepmother, here's the information, they can accept that. So we have to educate folks. But that other part, too, of making sure where they get out. But you're talking about something very important, which is part of the problems that so many families talk about. We're letting the disease dictate the treatment plan. And if part of this disease is the person is going to deny they have an illness, or part of that is a paranoia, we want to help them. We want to be compassionate. And again, if someone had Alzheimer's, we wouldn't say, your grandmother who's walked out of the house is wandering down the street, we're not going to do anything because she's refusing treatment. We wouldn't do that. We would get that care for them.
That's the thing, we have responsibility, but we have no rights.
Well, I think...
Point fingers at you,
Yeah. Well, see, I believe people have the right to get better. They have the right to treatment, and what we treat this as a nation of, it's the only disease where we're saying they have the right to refuse treatment.
This conversation makes me believe more than ever that we do not need one large shelter in the area. We need several. We need special services for the mentally ill. We need special services for those who are suffering with addiction, for those who have lost their homes and jobs and whatever. Homelessness is not a single issue. It's an issues that we fail to recognize. The basic reasons why we have homelessness is everything, all kinds of reasons. So I just think we need several shelters. We need shelters to deal with each of these different problems, with like a residential situation for people to stay as long as they need help. Thank you.
Thank you.
Let me just add to that. I can tell you, at least in the last 15 or 20 years, one of the biggest challenges in our communities here is homelessness, and it's about what you're talking about. And I've talked to the congressman about that, but I can just tell you that it just seems they're in our emergency rooms, they're in our jails. I talked to the major the other day that heads up the jail in Sarasota County. A lot of them are homelessness, staying in a lot of the beds there. So it's a big issue, and we, a community that's fairly well endowed in many ways, we've got resources. We should find a way we can be compassionate, but at the same time, there's merchants and there's residents and everybody else that feels like they can't do business. So it's a fine line, and yet we're dealing with this for 10 or 15 years. And I've been talking to the congressman about what the bill might do, but also what we can do in the community, because I think part of the everybody knows in this room, there's been so much written about it by the papers, and we're still nowhere, in my mind. And we've got to find a way, and that's kind of what got me more involved here. Plus, I was on the VA for many years, 4 years, and to have veterans that are homeless makes me sick personally with the resources we have. So a combination of these things, and then what we're talking about here, you just don't realize until everybody's affected. One of my best friends, he had 4 children. The oldest 2 were model citizens, law degrees, and the third one came along and was bipolar. The family had to intervene, and so everybody's got that personal story, and it's really devastating. But we've got to find a way forward because we haven't done anything with this in the last 60 years. And I believe Tim is moving in the right direction. He's got a bill that makes a lot of sense. My job is to get your input, and I want to try to pull the Florida delegation together in terms of Democrats and Republicans. We have the 3rd largest delegation, and move forward on doing something about this. You mentioned above 65. What is the increase on people 65 and older on mental illness? We were talking about that at dinner last night.
Yeah, seniors, the increase in suicide rates has gone up 38%. People over age 45, it's gone up about 50% in the last several years. Now, if any other disease saw those kind of increases, even down to something as minor as the flu, all the bells and whistles would go off. People would say, my gosh, this is a huge tragedy unfolding. It's barely a blip on the radar screen when it comes to mental health. And I got to tell you, you're blessed to have someone like Vern Buchanan here, because his passion in driving this forward and trying to get the Florida delegation will be essential in moving that forward. I hope you have the same passion and not only work with him on this, but if you're from another area, work to get your congressman on board, get your local county commissioners to endorse this bill, work on many levels because it's needed. I think somebody else has a question here.
In terms of private insurance, it's easier to find a psychologist that accepts insurance, but it's extremely difficult to find a psychiatrist that accepts any of the insurance plans. So that makes it challenging for someone to have medication management through a psychiatrist.
Well, a couple of things on that. First of all, we passed a few years ago a mental health parity bill, but unfortunately it took HHS 4 or 5 years to come up with the regulations, and states are still not following it up. So there are laws that say that insurance needs to provide for this. The second thing is, there's just not enough. There's 7,000 child psychiatrists in this country. We need 30,000. There's too few clinical psychologists. Now, this bill does a couple things with that. One, there was a program that worked in Massachusetts where they could use telemedicine, telepsychiatry, that a pediatrician, at the moment they're interacting with a young adult or family physician, wherever it is, they could get a psychiatrist right there in telemedicine, telepsychiatry, right there on the screen. That's very effective. We know that when someone has their first encounter with this issue, by the way, the average time span between first symptoms and first appointment for treatment, any ideas how many weeks? Average time span. 3. How many? 3 months. Any other guesses? 12? 12 what, weeks? 12 weeks. 12 weeks, anything else? 112 weeks. Over 2 years. And that time span averages between 1 year and upwards of 3 years. Why is that? Well, that's because a lot of times people don't recognize the early symptoms. So the benefit is, to help with this, is to have some of those family physicians, pediatricians, et cetera, train, and if they're not quite sure, they get that psychiatrist, psychologist right there on the screen, and they say, Dr. Smith, this is John Doe. Right away, take down the barrier. Start that communication right away. When that link happens with the family physician, it's like a 90 plus, 95% compliance. So we would actually move in this bill to have that covered as a service and provide some grant money for that as well. There's other things we know. We just need more psychiatrists and psychologists to treat this, and part of it is if they can't get reimbursed for having a hospital bed, and you know what I said before, Medicaid won't reimburse for 2 doctors in the same day. What an absurd concept. So we want them to be able to do that right away and take down some of those barriers. That's in the bill too. Somebody way in the back has a question, right behind you.
I think you hit it on the head with its billing. I'm a healthcare provider, and not too long ago, in the newspaper.
Can you speak up just a little bit?
Put the mic in your mouth. There you go.
I'm sorry. Not too long ago in the newspaper, I think it was the Wall Street Journal, they had an article about undergraduates pursuing a psychiatric degree. And they saw a huge decline. And one of the reasons were that the student wanted to actually counsel their patients, or they were finding that they weren't going to make any money in that.
Right.
So because of the billing system, they decided they wanted to go pursue it. They wanted to make a lot of money, but they were only seeing that patient for 15 minutes, issuing them a prescription, and away they went. I think our economy is something in this bill has to address our economy and the billing system, that our insurance company is making profit. I'm a healthcare worker. I'm a massage therapist for 20 years. This economy has affected my business and the numerous amount of stress. I've been faced with this personally, but as a massage therapist, I've had clients go through a series of foreclosures, and they've come to me for relaxation and to reduce their stress. I think that an alternative health care provider should be in this bill, whether it be post-traumatic syndrome and our veterans. My profession has been ignored. I'm a national healthcare provider, but still, if I would call or my clients would want their insurance to pay for this, they're denied. And I'm a valid profession.
Well, I appreciate that, and I'll be glad
I want to say one last thing,
Sure.
though, because I've been faced with suicide. One of the reasons why that number is so high is because people have been committing suicide between the ages of 50 and 70. I've had clients come to me and share their stories with me about how they wanted to go ahead and either go to a physician and their benefits were denied. So they accumulated this stress over and over again. So whatever this bill has to address, it has to address our economy.
Okay, thank you. I appreciate that, and that is an important issue, but I just want to be candid with you. This is not a bill to address the economy. This is helping families in mental health crisis. We have passed quite a few bills. We've sent 350 bills to the Senate, and they've acted on 0. 40 different jobs bills. That's a discussion for another day, but along these lines, and I'd love to talk to you more about the reimbursement area for some of those things related to your services. I just want to make sure that unlike whereas other medical diagnoses that get treatment, this one still doesn't. And we want to make sure we have that. Who's next? Okay.
My name is James Humphrey. I'm the Chief Operating Officer of the Ross Camp Institute.
Point that right to your mouth. Thank you.
I have a myriad of questions, but I'll limit them to a couple. One's addressing the homelessness. With the current veterans coming back, PTSD, TBI, Will this bill enable the clinics to open up even more and see veterans so they don't have to wait to get into the VAs?
Do you want to talk about just the
Well,
veterans bill?
we just passed the veterans bill, bipartisan, everybody in Florida, I think all the Democrats and all the Republicans, with the idea, because we've all read about the VA and what's been going on there, is if they can't get health care in a certain period of time, they can go get it. They'll give them a Blue Cross Blue Shield card, or they can immediately go get care. So I think we're moving in the right direction, but there's more that needs to be done as it relates to that. So there's still more effort on behalf of all of us that we're still working on that. So I think it's moving in the right direction, but we're not there yet.
I also put an amendment in the Defense Appropriations Bill to put an emergency $10 million in to help to hire more mental health providers within DOD. So we have veterans, so those who I think farther than 40 miles away or have a longer than 30-day wait, they can go somewhere else to get paid for that. So you work with the VA, or you work with veterans?
I've got an appointment at the VA, but
Okay. So in addition to my congressional job, I'm also a lieutenant commander in the U.S. Navy Reserves. I work at Walter Reed National Military Medical Center, where I do my Navy duty as a psychologist on a PTSD, traumatic brain injury unit. And I know firsthand we do not have enough providers in the Department of Defense. You can't have a delay there. I mean, there's sections we just don't have a psychologist. And I think when you're dealing with someone who's a veteran, to say when that person, and I've known patients like this, they call and they say, I have an emergency, and they say, you're going to commit suicide? No, but I'm just falling apart. Okay, we'll see you in 3 days. No, you can't do that. You need to say, come now, do you need a ride? Or stay on the phone, we'll talk to you right now. It is an urgent crisis. What I look to folks like you, and thank you for saying that, is your voice needs to be heard on your county level, your state level, and your federal level. To call and say, this is not pretend, this is not a game, these are people in real need. And think about this. I'm old enough to remember when flight attendants, first of all, they couldn't be married. And if a flight attendant was pregnant, by gosh, she was out of there. Remember when you never talked about breast cancer? And now you have races, you have all these tens of thousands of people show up wearing pink shirts. You have NFL players wearing pink socks and pink shoes. Talk about these things. Still, mental illness is in the shadows. We don't want to talk about it. We're afraid to because of those stigmas. And the more people, everyday Americans, speak up and say, this is a real brain illness and we need to talk about it, it's going to be important. Oh, back there, yes.
Hi, Congressman. My name is Frank Heddy. I'm an Air Force Vietnam veteran, and I go to the VA hospital in Tampa about every 3 months. And see all these people out here? This is about the average morning of veterans in the mental health clinic area. And a lot of us veterans, we got mistreated by the people that do the compensation hearings. Like if you lose an arm or a leg, that's worth so much money in the VA system. They just don't treat us the right way, and the people that do they do your evaluation about what compensation hearing is worth, then they say, well, this is only worth so much. But a lot of the veterans are afraid to do what the right thing is to get the help that they need, because they're all afraid of getting turned down or being mistreated, or say, well, you don't have this illness, you don't have that illness. I think Congress needs to check out the people that's doing the compensation hearings, because they're not treating us veterans correctly, and they don't give us the respect that we deserve. So that's why we need your help.
Hey, Frank, first off, thanks for your service. But let me just say, we have an office in Sarasota and Bradenton, and any veteran that's earned a benefit, we're going to do everything we can to fight to get that benefit. Sometimes there's a percentage that you get. We don't agree, but that's what the VA comes back with. But we'll keep fighting until we feel like we can get where it needs to be. So any veteran in Sarasota, Manatee County that's got an issue as it relates to a disability or something, we do everything we can because they've earned that benefit to make sure that they get it. And I would just say, as you know, Joni, but we need to let anybody know, talk to Joni in Sarasota, but we have an office in Bradenton and Sarasota to address our VAs. And we have probably, I think there's 1.7 million veterans in Florida, but in our congressional district, we got 70, 80,000 veterans, and we try to do everything we can. And there's more that needs to be done, but we try to do everything we can to help the veterans.
Yes.
Yes, I'm a provider. A mentor once told me, and it made a lot of sense, sometimes you have to eliminate the red tape and roll the red carpet. You mentioned about the 16 beds, which leads to the IMD issue. And one of the challenges we're having around the country is the DOJ is going in and they're shutting down group homes in states, and they're classifying them as an IMD, even though there's no treatment being provided. Even though I'm hearing in the room that there's a tremendous need for more ALFs like the one that I operate, but we can't do it over the fear of the cloud of the IMD. So are we going to look at like an Innovative Practices Act to possibly repeal the IMD, or to put a defining line in the sand to where if there's no treatment provided? Because by having more structured facilities like that with the collaborative partners with your providers in the community, you can avoid, in a lot of cases, state hospitalization.
Yep.
So the issue is more than a money issue. The issue is an obstacle to the access due to these laws that actually prohibit people from getting the care they need.
Well, the issue of the Institute of Mental Diseases exclusion under Medicaid is one of the factors that causes shortage of psychiatric beds, and our bill directly addresses that there will no longer be this 16-bed cap. It's an absurd, arbitrary number that interferes with care. We do have in there that we want institutions to have an average length of stay of under 30 days. And we want to make sure that at age 22 you don't magically get cut off. Especially because you realize with severe mental illness, and understand this bill is a lot in the severe mental illness space. It's not in the short-term anxiety disorder space. It's not in the little adjustment space. This is severe mental illness where there's a desperate need for these kind of services. 50% of the symptoms of schizophrenia and bipolar severe mental illness emerge by age 14, and 75% of the time they emerge by age 25. So if we're not dealing with this adolescent and young adult population, we're not helping them. And very often when these symptoms, I told you 112 weeks for the first one, when it hits with such fear and worry that sometimes that person needs stabilization in an inpatient setting with the right qualified people, not those old institutions, not those asylums built in the 1800s where we just house people in warehouse. Those are awful. But to say we need quality care there, but that's what this bill directly addresses.
I'll just add a personal story. I had a friend call me when those kids were killed up in Connecticut. And before they knew who it was, he said to me on the phone, he said, Vern, it's an 18 to 22-year-old male, and he just picked it right up, and it's exactly what you're talking about. I didn't hear that statistic before, but it was just amazing. It was scary when he profiled that person before he had really heard anything. Let me do this. We're on a schedule, so we'll take a couple more questions, and then we'll be around for a few minutes after if anybody else has any. So we got 1, 2. Yeah.
Tim,
Yes, ma'am.
Tim, thank you very much
yes.
for your commitment to this. It's very, very important. However, given the fact that our current governor has
Could you speak up a little bit?
Given the fact that our current governor has chosen not to accept Medicare services for Florida,
Medicaid.
how does that impact his acceptance, and do we need his approval to pass your bill?
Well, you have some Medicaid services in Florida. It's additional things, I think, related to the Affordable Care Act, and this is still iffy because the courts have said, 2 federal courts have said if they're not part of that, then people don't get reimbursed at all under the Affordable Care Act. There's lots of things going on with that. I'm not here to tell you how to run things in the state of Florida. I am here to say, we are here to say, that this has got to change on the federal level. The incentive needs to be to get people care. The disincentive exists right now. If states say, hey, we can save money by closing down hospitals, closing down institutions, we'll just let them go to jail. Because you have to put it, because when a judge says this person, if someone gets arrested, they have to go to jail, you have to care for them. And after all, I'm being a little sarcastic here, but after all, the mentally ill people don't speak up. They don't advocate, right? They don't do that. They're quiet. We need family members to speak up with a huge voice across America. But I want you to understand what this bill does. It is not just about spending more money. When we find the federal government says you can't see 2 doctors the same day, you can't have enough hospital beds, families can't talk to doctors, in so many other barriers we see in this, we're going to tear down those barriers. When Vern mentioned $125 billion spent by the federal government, it's scattered all over the place. Department of Defense, Veterans Affairs, Labor, Education, HHS, but nobody is accountable. No one says, is this working? And what we have in this bill is an accountability. If it's not working, it goes. If it's working, boost it up. If it's redundant, merge it. Have continuity. That's why this bill has an assistant secretary of mental health for those 60 million Americans with some level of mental illness to say, what is the federal government doing? We want this person empowered to go through all those nooks and crannies and cubbies throughout the federal government and say, we're going to work together, folks. Imagine if the Department of Defense was scattered around 10 different federal agencies. Oh, we can't defend ourselves until we go through all these different things. You can't do that. You have to coordinate these efforts. And then, but this Assistant Secretary of Mental Health would also be responsible for gathering all the information from states and putting out together, this is something we're going to add to the bill and reforming it, is this person put an annual report out, the state of the states in dealing with mental illness. That is a huge incentive for governors and state legislators when they start looking at that and saying, we're not doing so good, or we're doing great. Or look at the states that are doing a good job, like New York, assisted outpatient treatment law, okay? So Laura's law is out there as an alternative to jail, the cycle of jail and emergency rooms and homelessness. What they found was, this is a Duke University study and Virginia Law Center study, said, when they began to work with folks, say, you need to stay in outpatient treatment instead of going to jail again or going to the hospital again or the emergency room again, they found it reduced incarceration of the severely mentally ill by 87%. Now, I don't know about you, but that's a pretty big statistic. They found it reduced homelessness and emergency room boarding by 70+%. And they found it cut costs by 46%. Now, that kind of data is important. So I think as states and governors and Senate and House members in the states look at this stuff and begin to look with the counties and communities of how to do this, it's a game changer. That's why this bill has to be comprehensive. It has to be big. It can't be a tweak. I'm not going for tweaks. we're going for big.
Let me add one quick thing, and then to the gentleman, to your point. I can just tell you, the state hasn't had the extra money because of 08, 9, 10, like a lot of people tighten up, but they have surpluses now. I talked to the governor on some other things the other day. The administration up there in the state was against databases for prescription drugs. We got the leadership on that, and Pam Bondi and a lot of us in Congress, and we got that resolved here in the state of Florida. This is a big enough issue, as I've watched it over the years. This is something that's going to get their attention. They have the money. He mentioned that they have surpluses now. But we need to take some of those dollars and invest in the individuals and the families in our communities because it's out of control. Thank you.
We have him and then her. She has a question too. This gentleman and her, I know we're short on time. But
yeah.
Yes, Congressman, I want to alert you to a really big problem that's coming. We have a whole group of troubled kids who are loaded up on psychotropic drugs. 1, 2, 3, 4, sometimes 5. And these are developing brains. We really need to look at this group of people, I hope you have in your bill, and get them adequate care that's interpersonal and not just somebody giving them another drug. This is a real troubled group of kids, and they're going to be troubled adults.
Well, let me tell you a couple of things that makes that even worse. 72% of psychotropic drugs are prescribed by non-psychiatrists. Now, I understand a pediatrician or a family physician prescribing a mild antidepressant or something, but when you get to the level of someone who is schizophrenic or bipolar, that better be in the hands of someone who knows this issue. I'm a psychologist. I certainly would not want to do heart surgery. Maybe I can do CPR if someone needs it fast, but it's a situation you're getting that right. Well, one of the things we do have in this bill, too, is dealing with prescriptions. Medicaid, Medicare, we're trying to actually restrict prescriptions of psychotropic drugs, antipsychotics, antidepressants. We had it down as a protected class of drugs. Now, let me tell you a quick story. They actually had it says, no, we think it's too many, so we're just going to approve one of each, or something like that. We said, how could you do that? They actually had the standard there. I don't think you knew this. They had a standard that says if you're not rehospitalized within 7 days, the drug isn't needed. So we had this guy come in, his name was Cohen, in front of me. I was not feeling too happy with him that day, and I said, now, do you know, I had him read a letter from the American Psychiatric Association, which actually described these drugs and understanding that many of these drugs take 2 to 6 weeks to be effective. So this 7-day hospital is ridiculous. Yeah. It takes a while. And if you're withdrawing a person from one drug, you have to wait till they're off of one to start the other. This is fairly complex. You need someone who knows what they're doing. So I had him read this letter from the American Psychiatric Association, and one of the things it was describing was SSRIs and how they work. So he finished the reading the letter. Now, this is the guy that made the decision not to allow these drugs. And I said, now, sir, I have a question for you. What is an SSRI? He said, I wasn't briefed on that. And I said, but you made a decision on that. And he says, how about if you go back and promise you're not going to do this? He said, well, I can't really do that. And I said, well, then you're practicing medicine without a license. And all these things are on your lap, including the high number of suicides among men, elder men, with a much higher rate, especially when they get diagnosed with chronic illness. Well, the long and short of it, with a week, they reversed their decision on this, and that's good. But we still have to lock that in place. Well, look, we need more psychiatrists in this country, too. And part of what we have to recognize in the future is some other incentives to get them there. But in the meantime, part of our bill is to make it easier for those things to access. So rather than psychiatrists going clinic to clinic, we know that telepsychiatry and telepsychology can be very effective in making that immediate contact with someone, so it's someone who really knows. And whoever that story, too, about all the different places that they're going to, you can't have that kind of hodgepodge approach. It has to be very carefully coordinated or it makes it worse. Ma'am, you had a question, then we'll probably should.
Excuse me. Thank you for coming here. I'm a physician that's disabled with chronic pain, and your bill sounds wonderful for very severely ill people and mental hospitalization.
Mm-hmm.
We need it. Thank you. I want to
Thank him, too.
Thank you. There's such a great interplay between the mind and the body when you have a chronic illness, when you start getting older, and you hurt or you have other diseases, and it's so easy to get depressed and become anxious, and that's why there's so much suicide. What I found out recently is that Medicare is not covering acupuncture. And I think that it'll have a profound effect in lessening the number of severely mentally ill people who need to be hospitalized and who commit suicide if you could do that. Now, it's probably not part of your bill, but it could be, and maybe there should be another bill, and I hope that you two congressmen will listen to what I said.
I think there are some bills that have been introduced dealing with acupuncture issues, but let me just say this. When people with a chronic illness, half of them are likely going to have depression. And of those with depression and chronic illness, it doubles the cost of health care if it's untreated depression. Pain is also associated with a lot of depression for multiple reasons, directly, primarily from the pain, and secondarily from neurological changes that occur with pain, as you're aware. One of the cases they're raising about Robin Williams is that with Parkinson's, as a diagnosis, it also affects some neurotransmitters, serotonin, dopamine levels in the brain, frontal lobe, which also can have a direct effect upon depression. And these things need to be addressed. I've had acupuncture myself for pain too. I know it can be very effective under certain circumstances. Now, this is another issue, but in the Affordable Care Act, once they have that independent payment advisory board, 15 people, by law, half of them are not medical people, deciding what gets paid and what's not and how much. I can't imagine they'll make a decision on allowing acupuncture, quite frankly, and it would require an act of Congress. I think it's a supermajority of Congress, and the president would have to sign it. So you can imagine if you prescribe that, that's a whole other issue. We'll get another. I'll let Vern handle that another day.
Okay. Let's take one more, and then we'll wrap up, and we'll be around for a few minutes after. Yes, ma'am.
Congressman, I noticed that in the state of Pennsylvania, you have several clubhouses. Are you aware
Clubhouses
of
are
the
great,
clubhouses?
yes.
We have a fabulous one in Pinellas County. It's the closest one. For those that don't know, I don't know if Congressman Buchanan needs the brochure, if you know what it is.
I'd like to get a brochure.
It's absolutely amazing. This is a place where people can go to restore their lives when they've have and continue to have mental illness. They can go there daily. It's real work. It's back to work. It's support from other people that are like them, as well as qualified staff. And I think Florida has, 5 now.
Yeah, Florida has some great ones on there. So the
we
clubhouses is, what she said is so important. Professionals who are trained, as well as people who've been through this, and they can support each other. We know that that type of peer support from people who also have additional training and have really recovered a lot can be very valuable. I know in the military, we do it all the time for people who have been through combat. They can be very effective in helping other soldiers. Similarly, if people have gone through recovery of mental illness, similar with if you're sitting around with talking to people with heart disease or diabetes or lung disease, we need that kind of support from each other. And so the clubhouses are very valuable. They're a great program.
Let me just say, I want to thank everybody. Get me your input. I'll make sure it gets to the congressman. Sally's here, our district director, or Danny, if you've got anything. But I appreciate you've been a great audience. Appreciate your effort. And let's give the congressman a big round of applause.
You too. Thanks, Vern. Good stuff.